All India Institute of Medical Sciences AIIMS Director Dr Randeep Guleria on this Thursday said that the COVID appropriate behavior, including proper masking, washing hands, avoiding crowds, and vaccination, is crucial. However, the AIIMS director asked people to stay alert, not panic, as it is a mild disease. Meanwhile, Dr. P.S. Chandra, professor neurosurgery, AIIMS in New Delhi, said that the COVID-19 cases, which are rising exponentially now in the country, will start declining in a few weeks. But caution is important and we should prepare for the worst while hoping for the best. There are reasons to believe that this will be over within weeks, as it has happened in Africa and South Africa. Hardly has any cases as of now. Numbers are reducing. So these are the silver lining, but again we have to be cautious for a couple of reasons. First, it's very infectious. So obviously, we should not let our guard down. So continue masking, continue social distancing, then continue working from home. Avoid any kind of unnecessary travel. Avoid any kind of unnecessary gatherings. Public gathering is to be completely discouraged. So all these things have to be continued, said Dr. Chandra while speaking to ANI. He further said the Omicron virus is highly infectious and it is going to increase the herd immunity. There are several silver lining into it, and we should go forward with a sense of caution. And our strategy should be that we prepare for the worst and hope for the best. A large number of people are asymptomatic, which is good in a way because it's likely to increase the herd immunity. So more people get infected, they are completely asymptomatic. Obviously, it's going to form the immunological barrier to prevent the further stretch. And again, lastly but not least, because it's highly infectious, he said. Dr. Chandra showed concern over hospitalization and emphasized taking precautions. The second concern we have is that because we have a huge population in our country, so even if 1% for the population would require hospitalization, that would be a huge number. We don't want our hospital infrastructure to collapse. And from the perspective, it becomes the responsibility of each and every citizen. They should not let their guard down saying it's only a mild infection. So they have to be careful not just for themselves but also for the entire community. We do not want to increase the burden on the community so that all our hospital beds are clogged, he added this point. He further said the most resident doctors in his team are sick, and if healthcare workers get sick in a large numbers, then that will lead to trouble for the entire or the whole system. We have to protect our healthcare workers. They have to take full precautions because they are soldiers on the front line. So if they are going to fall down, who is going to take care for all the patients? So for instance, in his unit, almost 50% of the residents are sick. They are all having mild symptoms. They are doing well, but the fact is they have not been able to report for work. So that's very crucial that the healthcare workers must be protected, not just for their own sake, but also for the sake of taking care of people who are sick with COVID-19, said Dr. Chandra. Never miss a story, stay connected and informed with Sathyamoorthy.